because it's more of a lifestyle coaching setting, it can really help someone understand how they can control the situations that sometimes led to overeating or sedentary behavior, some of those activities that can lead to pre-diabetes. And so not only is it something to tackle the immediate need, that pre-diabetes sort of hanging around their neck, but also help them become responsible and take some control over preventing it as they go into their future.
The National Diabetes Prevention Program, or National DPP, is a partnership of public and private organizations working to prevent or delay type 2 diabetes. K-State Research and Extension is working with the University of Kansas Medical Center to see if having extension-delivered diabetes prevention programming across the state is an effective way of getting information out to rural areas. On today's Sound Living, a lifestyle change program that can help people reduce their risk of type 2 diabetes. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. K-State Research and Extension Nutrition Specialist Sandy Procter is one of 4 extension specialists and agents in Kansas who've been trained as a national DPP coach. She says the pilot program they'll be conducting is for those who may be at risk for type 2 diabetes.
Right. They are considered pre-diabetes or at risk for type 2 diabetes. And so they haven't received that diagnosis yet. But we know just from looking at nationwide statistics that many of us are at risk for type 2 diabetes. And we can learn that by a simple questionnaire. Do you have type 2 diabetes that is available? And the answers to those questions can lead to the fact that you may be at risk, but yet the diagnosis is not there. So there is a very important point at which we can reverse some of those symptoms and actually take control and a better trajectory toward health.
I think weight is one that most people think of as being a risk factor. What are some of the other potential risk factors?
Typically having an overweight and needing weight loss. And this is the part I think that is really of interest to a lot of people. And a lot of people are really heartened when they find out we are not talking a large amount of weight loss. We have seen some of those tests really show great improvement when a person has just a small amount of weight loss. It can be as little as 5%. It doesn't take a major focus on weight loss and a major loss of a huge percentage of body weight. Just that small amount can really change some of those numbers and allow some of the other signs and tests to come out more positive. That really is one of them, but that weight loss then leads to some improved other test levels.
You were mentioning to me that this is a year-long pilot program, so this is really an intensive program.
Yeah, the pilot is going to be for 6 months, and the program, when it's delivered in its entirety, lasts for an entire year. And the reason for that is, again, it's not the focus so much on quick-term weight loss, but rather a lifestyle change and some of the many factors that go into changing the course toward a diagnosis of diabetes, away from that toward a healthier lifestyle. And that includes factors about weight, but also types of food and beverages that are selected, amount of physical activity, stress and sleep, and some of the lifestyle management things that go along with good health.
Is that one of the reasons why KU Med Center was interested in working with Extension, is because they have knowledge in all of these areas?
I think it's a perfect storm when you think about it. They recognize our ability to have offices. We have offices across the state. So all of those rural communities where there may not be a Department of Public Health or a health department in every community, but in every county there is an extension presence, and there is extension professionals working in those offices that are in many cases already focusing on some of the health factors in their community, very knowledgeable with the audiences. They have a trust relationship with the people surrounding their health. We've, as you know, been working with the culture of health efforts across the state, and some of those had to do with, increasing the availability of sidewalks and walkability, increasing the likelihood that healthier food is available. So really related factors. Extension is involved in all of those things. And I think KU Med recognized that here they had this perfect sort of set of educators in every county in the state, and it would be a perfect way to get this very focused program out to people who really are at risk. We know that there is a big prevalence of prediabetes, unfortunately, all across Kansas. It doesn't matter if you're rural or urban or even young or old. It is a high prevalence in all of us. And so being able to work with a partner out in rural communities is a real plus.
Because that's probably the hardest area to reach, right? The rural population?
Well, it is, because there isn't a real consistent way to do it. Some of them will have an office or a medical center that they might be able to deliver some sort of health-related program through, but many won't, and they would have to travel to the next county for such a program. And so we're partnering and seeing just how well it can be delivered through Extension, with Extension being trained specifically on this CDC program.
The two people that will be leading the pilot project are based in Dickinson County and then the Central Kansas District?
Right. Emily Krause and Leah Robinson are the two agents who have been very willing and selected to go forward with the program in their counties, the pilot program. And it was originally planned to be one of those in person and one of those as an online class to test which of those might be more effective. But with the advent of COVID and everything moving to distance courses, it was decided that it would be two different modes of online, so like a Facebook group and online training. So there's going to be testing two different delivery methods for the program to see if there's a difference in effectiveness.
And I think you were telling me that this is not really a food-type event. This is based more on lifestyle changes?
It really, of course, addresses food. We know that diet is a very important part of weight and of diabetes control and diabetes prevention, but it reaches beyond that to really, like you said, lifestyle factors. And so exercise and sleep and selecting the types of foods and beverages, but I guess a broader emphasis maybe than the Dining with Diabetes program that has been so successful and so familiar through K-State Research and Extension already. And that audience typically is a caregiver or a person that has diabetes. And this program very wisely aims at people who are not yet diagnosed with that. And for health's sake, that is really key, to have the knowledge that you can change behaviors now and prevent this really costly, in so many ways, disease.
Tell me about the training that you went through. What were some of the things that really stuck out in your mind and made you think, yes, this is something that might work very well in Kansas?
I was really interested in seeing what types of things we would be taught about. And I think one of the things that was really interesting was a lot of it was coaching methods and really helping people understand why they do some of the things they do and helping people understand where some of their habits and their practices come from, rather than the sort of stand-up talking head lecture. You need to do this, you need to do this, you can't do this, you can't do that. That is not how this works at all. It's really arming people with healthy skills and the capacity to identify the factors in their life that can be changed for the better.
I assume since this is going to start out as a 6-month pilot project and then a year-long program after that, there's an opportunity to kind of ease into this and present a lot of content to begin with, and then maybe you start working on other things as time goes on?
Well, the curriculum itself is very set, so we would be following it just the way that it has been delivered. That's one of the reasons for the training, is to come up to be very familiar with this set curriculum. And my understanding is that KU Med Center chose 6 months for the intervention length. That's the majority of the DPP sessions occurring within the 6 months, and then after that is more of the maintenance and check-in. So that 6 months time will be the one where really some of the changes and the evolution of thought process and skills would be learned. And also for the pilot, it was a shorter funding time. But that first 6 months then is going to look at body weight assessed at the baseline, and then again at 6 months, participant retention. Both sides, KU Med Center and Extension, are interested in knowing, will participants stay with something over a 6 month time? We know in other states that they really do. This is something that they can really see results and tell that things are changing. They'll have 16 sessions in that 6 month period and see what percentage they attended, and also look at then how the lessons themselves were delivered, the difference between the online and the Facebook delivery. So they'll be looking at the fidelity of the delivery. So it really is a research project, but the beneficiaries will be those people that get to take part locally. They're going to recruit 20 adults, and hopefully they'll have about 15 participate that have pre-diabetes, and that means that their A1C levels, which is a measure of blood sugar over time, will be at specified levels, or they have a positive result based on that screener that we talked about. Are you pre-diabetic? And Jeff, I did a thing on that maybe a couple of years ago. Are you pre-diabetic? And so it's one of the pieces that we have used in K-State Research and Extension. It's a publication that I did that people have used a lot to sort of just ask themselves these really simple questions that ends up pointing to, are you pre-diabetic? And then what you can do with that information.
So if they can make some simple changes, they actually can improve their health significantly with just a little bit of weight loss, as you were pointing out, and maybe just a few other lifestyle changes.
That's exactly it. And because it's more of a lifestyle coaching setting, it can really help someone understand how they can control the situations that sometimes led to overeating or sedentary behavior, some of those activities that can lead to pre-diabetes. And so not only is it something to tackle the immediate need, that pre-diabetes sort of hanging around their neck, but also help them become responsible and take some control over preventing it as they go into their future. So keeping active, controlling their weight, watching the types of foods and drinks that they choose, and really working to be, in charge of some of those factors that might have been just sort of happening to them before.
If the research from the participants comes back well following the 6 month pilot project, you will then possibly look at expanding the program across the state?
Well, actually, yes. We are talking to have a wider, if it's funded, the KU Med Center is looking at having a wider program, working with Extension across the state. And we in Extension are also interested in seeing what factors we might need to think about ahead of trying to take this statewide as a program. So both parties are interested in looking at what might be needed to take this to a bigger scale.
Yeah, I imagine because of the fact that this is so labor-intensive for the program leaders, it may be something where we have to decide whether or not someone just takes this on full-time.
That's exactly what it is. When you think about how busy our extension agents are and educators across the state and the many programs that they have going on and the number of things that they need to do, you can see we're having something where it's a year-long commitment. Even though the curriculum is completely set, the lessons are pretty packaged and ready to go. It's not like the agents would be responsible for creating those, but just the time commitment and the recruiting for the programming and then the individual connection as a coach back with those participants is especially labor intensive for that first 6 months when they're in the active phase of the program, and then they move into a less contact sort of maintenance phase over the last 6 months of the year. But that's a lot of commitment for both people in the community and that educator. So we're both looking at seeing, what modes of delivery of this education are effective and how much person power it would take to deliver it successfully.
That's K-State Research and Extension Nutrition Specialist Sandy Procter. More information on health and nutrition programming across Kansas is available at county and district extension offices and online at ksre.ksu.edu. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.